Hi, everyone. Welcome and thank you for joining. My name is Linda Denude, and I'm a health educator for community health at Atlantic Health System. Today's presentation, How to Maintain and Improve Balance, will be presented by Marguerite Maloney. Before we begin, I have a few announcements. This webinar is being recorded. All participants are muted. If you have a question, please use the Q&A feature, and for all comments, please use the chat. We'll try to get through all questions at the end of the presentation. Are you or a loved one interested in smoking cessation? Atlantic Health System offers a free quit smoking program. This program includes an individual assessment, free nicotine replacement products, and 6 weekly group meetings to help you quit and stay smoke-free. There are multiple dates and times available, with groups available in person or virtually. For more information about these groups and other resources, or for additional dates and times, please call 1-844-472-8499. I'm now going to turn it over to Marguerite. I'll pull that up in one moment.
Well, good morning, everybody. My name is Marguerite Maloney. I'm a physical therapy assistant at Hackettstown Medical Center. We are with the Atlantic Health System. Next, please. Next, Linda.
Yes, 1 second. Sorry, delay. Okay. Slight delay on my end.
So today's seminar is on how to maintain and improve balance. This slide is about my background, just so you know where I'm coming from. I've been in the field of physical therapy for 40 years. I have been actually at Hackettstown Medical Center for 30 years. So I have a lot of experience. Basically, my background has been orthopedic outpatient. I have done some inpatient work in the hospital for many years, but at the moment we're focused on the outpatient clinic. We're on the 4th floor of the medical center, and we have a lot of services here. I just wanted to tell you about what we have here. We have speech therapy, occupational therapy. We have a fitness gym, physical therapy. We have a pediatric unit in our facility that has its own physical therapist and occupational therapist. You know, and a lot of you have grandchildren or children. That's a nice thing to know that is around, because people drive all the way to Morristown. They don't know we are here for pediatrics. So today I want to talk about balance and maintaining it and improving it. Because my background is in orthopedics, I was kind of looking for an adjunct that would help. People's balance is affected in all kinds of diagnoses. So when I saw this certification for a fall prevention specialist, I decided to pursue that, because I can use all the exercises and information with pretty much every diagnosis I see. And we see everything here, not just orthopedic. We have a lot of neurological involved patients. So, you know, fall prevention and balance are really key to all ages and all diagnoses. My other interest in why I wanted to pursue it is, you know, I'm aging too. I had my hip replaced 2 years ago. I want to be able to hike and walk my dog and play with my grandchildren, you know, so what can I do to keep myself active and able to do all the things I want to do? Next one. So you can't talk about balance and without talking about falls. So this is my sad slide. So these are some things that, you know, falls are very relevant, and a lot of things can happen after a fall. So this just lists some of the things. A quarter of the Americans aged 65 and older fall every year. Every 11 seconds, an older adult is treated in the emergency room for a fall. Every 19 minutes, an adult dies from a fall. Falls are the leading cause of fatal injuries and the most common cause of non-fatal trauma-related hospital admissions among older adults. Falls result in more than 2.8 million injuries in the emergency department annually, including 800,000 hospitalizations and more than 27,000 deaths. In 2013, the total cost of fall injuries was $34 billion, and in 2020, the cost has reached $67.7 billion. Falls are the leading cause of loss of independence. So, like I said, this is my sad slide. So I want this to be motivational for you, not depressing. Okay, so there are things you can do to help these numbers decrease, and the government and the hospitals are investing a lot of money in fall prevention and balance. So this is a very relevant topic because of all of these things listed. Next. So what happens to our balance? So let's do an overview of balance. So many body systems, including your eyes and your muscles, your bones, your nerves, your heart and blood vessels, must work normally for you to have normal balance. When these systems aren't functioning well, you can experience balance problems. So we're going to break down these issues, and some of you may have serious balance issues that have greatly affected the way you live, while some of you might just have some strength and flexibility issues that are causing you some concern in certain situations. So I wanted this to be as simple as possible, but it's not always that simple. So what I want is that as you're listening to the things I'm listing and talking about, I want you to think about what your personal issues are. Are you relating to the symptoms that I'm talking about that are more serious issues, or are they the easier to fix issues? So, if you're starting to relate to some of the more serious things, then you really need to seek attention, and we'll talk about that as we go. Next. So we're going to talk about the serious things first, okay? So vertigo. So vertigo, and you might hear this word thrown around a lot, but it specifically is the sense of motion or spinning. So if you're getting that when you're changing positions, I'm going to talk about diagnoses that involve vertigo. This is not going to get fixed by practicing just some simple balance exercises. So as I describe each diagnosis, kind of think about where you are in this, okay? So benign paroxysmal positional vertigo. We never say that whole thing. We call it BPPV. This occurs when calcium crystals in your inner ear, which help you control balance, are dislodged from their normal position. Yes, you have little crystals in your ear. It's weird. This is when you feel imbalanced, or you're spinning when you turn in bed, or you tilt your head. So this could be like a really bad issue for people. You go to get up out of bed on a certain side and the whole world is spinning, and it's very hard to get it back. Vestibular neuritis, this is an inflammatory disorder. And it's likely caused by a virus that affects the nerves in your ear, and you may be nauseous, or you might have difficulty walking. Persistent postural perceptual dizziness kind of occurs with those other two things. And because of the vertigo, you're starting to develop symptoms like unsteadiness or the sensation of motion in your head, and symptoms worsen when you watch objects move, or when you read, or when you are in a visually complex situation or environment like a mall, or you go to a movie, a 3D movie or something, something that the stimulus is a lot and you just start to lose it, So that diagnosis kind of goes after you have the other two things. So those first three things we're going to discuss again because there's things you could do for that. Meniere's disease, that's in addition to having vertigo, Meniere's can cause fluctuating hearing loss and buzzing and ringing. And the cause for that isn't really fully known. Migraines, they can cause dizziness and sensitivity to motion. Acoustic neuroma is a benign, slow-growing tumor that develops on the nerve that affects your hearing and balance. And common symptoms are hearing loss and ringing in your ear. And head injuries cause vertigo from concussion and other injuries. Next. So I said I was going to talk about treatment. So for vertigo, on the first 3 diagnoses mostly, you need a proper diagnosis. And unfortunately, a lot of times the doctors will just put you on medication, but that's just kind of masking it. It's not going to fix the crystal or the nerve issue in your ear. BPPV, vestibular neuritis, and persistent postural perceptual dizziness can all possibly be helped by conservative rehab. So vestibular rehab is just amazing. It is part of physical therapy. It's another specialty. The therapist will assess your symptoms when you come in, and from the testing, they will know if it's a crystal in your ear or if it's just a balance issue. And she does different positional testing for that. And there's a thing called the Epley maneuver. So if any of you have had vertigo and have had somebody do that to you, you know what I'm talking about. It's a very interesting maneuver. You kind of turn on your head real fast, and we bring you up. And, you know, if you're having symptoms, she looks at, the therapist looks at nystagmus in your eyes. That can occur with vertigo. Nystagmus is a fluttering of your eyes when you start to feel the vertigo. So the therapist can do that maneuver. That maneuver can put the crystal back in place, but it might not just stay there. You're going to need exercises specifically to address that kind of thing. So I'm talking that up because I've just seen such amazing things with it for people who have just been suffering with that for a long time. And they do a really great job with that particular rehab. So if you're having any of the symptoms I'm talking about in those following diagnoses, you know, you really need to seek medical attention. There's medication for Meniere's, you know, there's different things for the other 3 diagnoses. Concussions also now is a big thing in rehab. We have a couple therapists that do concussion rehab. They take you through exercises, and we watch your vitals and, you know, your reaction to movement. And, you know, as you know from the news and football, concussions have come to the forefront of science and what you can do about it. Next, please. So another realm of feeling dizzy is the symptoms of feeling faint or lightheaded. And these are some reasons why you might feel that. So this is hemodynamic orthostatic hypertension. It sounds long, but all it is really a change in your blood pressure when you go to stand up from sitting or from laying down. You know, and a lot of you might feel this, you know, you get up real fast and just for a minute, you have to kind of sit there. So that could have to do with your blood pressure, and there are things to do about it. So, you know, again, that's something that has to be medically looked at. They take your blood pressure laying down and versus sitting up, and they might treat it medication wise or gradual teaching you how to get up without that happening. Cardiovascular disease is abnormal heart rhythms, narrowed or blocked vessels, a thickened heart muscle, which is called hypertrophic cardiomyopathy. or a decrease in blood volume that can reduce the blood flow and cause fainting or lightheadedness. So, you could be having something cardiovascular going on that can cause you to feel faint or lightheaded. Again, needs a medical assessment. Next. Another symptoms of balance is loss of balance or unsteadiness. So you could be having the vestibular problems we were talking about, which is abnormalities in your inner ear that can cause you to feel floating or heavy head or unsteadiness in the dark. You can have nerve damage to your legs, which is called peripheral neuropathy. We've all heard of neuropathy, it's that numbness in your feet and your legs. And that can lead to difficulties walking due to numbness and not getting the feedback to your brain from the surface you're standing on. Joint, muscle, or vision problems. You can have muscle weakness or unstable joints, as well as poor posture that can contribute to the loss of balance. And various eyesight issues can also have significant impact. People that wear glasses, like bifocals, can have depth perception issues. I know this has been an issue for me. I wear progressive bifocals, and I'm a big hiker. So, I'm trying to hike up these rocks, and, my depth perception is really an issue. So, and I will talk about this some more, so I don't want to jump ahead. Medications, check your medications for side effects, because that can really affect your balance. It's more common than you think. For example, blood pressure medication. You have a diagnosis of cardiovascular disease and you're on medication. Read your side effects, because a lot of them, can make you lightheaded or dizzy. What can you do about that? You can call your doctor and you can discuss the medication, and if there's an alternate med you can be on, there are some things you can do about it. Certain neurological conditions like cervical spondylosis, Parkinson's disease, multiple sclerosis are all examples. Next. So let's go back to treatment again. So the prior issues are treated again mostly by seeking correct medical attention. Do you suspect your medication? Have your primary care physician look over your medications. If you're not sure, you've been taking the med for a long time, you don't have the side effect paper with you, you're not techie, you don't look it up on the computer or whatever, it's always better anyway to have your physician look at your medication list and go over the side effects. Sometimes you go to a bunch of different doctors and you're getting different medications, and some of them, aren't supposed to be taken together. So, it might be a matter of that. You can also talk to your pharmacist. They should know which medications can go with which and which have side effects that might be causing you an issue. If you haven't had your eyes examined lately, maybe it's time. Talk to your eye doctor about what can be changed if your prescriptions are causing you perceptual obstacles. I do wear contacts to hike. That was my discussion with my doctor. I have dry eye, so contacts don't work for me all the time, but I can get away, for an hour or two with them in. And that actually helps with the depth perception. Maybe you don't need to wear, your reading glasses when you're walking. He also offered me, lenses that when you're on the computer, so you don't have the bifocal kind of thing. So there's things you can do, and maybe you have an eye issue that you're not even aware of, or your prescriptions are old and you need to be updated. Weak muscles or joints, maybe it's time to exercise. But that's a hard thing to just start saying, oh, you haven't exercised for a while, I don't know what to do, kind of thing. So if you're not sure where to start, you can seek a gym, and they have trainers there working there for a reason. So if they're a trainer, they have received training in exercise, which always includes balance and posture. You can look for a local Tai Chi class. Tai Chi is rated so high on every balance and fall risk seminar I've ever attended. I did get to even try it. It always looked just so slow for me, but now that I'm where I am, you kind of see the benefit in these kind of things now. So they're very slow, controlled exercises, and you will be very surprised how challenging it could be. Yoga, again, that was something I never really liked, and I tried it. I didn't realize how many levels of yoga was out there. So when I went to the class and I was overwhelmed, I kind of backed off, and then, I read a little more about it, and oh my gosh, it's just the best. If you can find the correct level for you, and there are chair yoga classes out there in many of the facilities and around Hackettstown. Or just a beginner series of yoga, they're not all back bend classes and they're not all hot yoga. So, you have to find the level that's right for you. If you still feel unsure, maybe you should see the doctor and get a prescription for physical therapy. If your balance issue is that horrible to you, but it's not medication or all the other things we were talking about, like I said, I am certified in fall prevention. So, you're going to come in and get an assessment, and we're going to work on balance in a safe environment with someone guarding you. So, it's a really great thing to do. I so enjoy working with those kind of patients because it get really fun. We try to keep the goals functional in mind. This is when you lose your balance. You're in the kitchen and you reach for a cabinet and you're trying to get a dish, and then you turn for the dishwasher, and you lose your balance. You step backward, someone's coming at you, step backward unprepared, and down you go. So, these are things we can really work on in a safe, guided environment. Next. So exercise, right? All right. Next. So what can be done? Okay, you want to exercise. Exercise combined with education, like I said, is the best. Then that's possibly physical therapy. We work on balance, strength, function, and power. All those other classes I mentioned are also those kind of goals. Next. So exercise is crucial to maintain your balance and strength. Have you heard, if you don't use it, you lose it? It's true. As we age, we don't do all the motions we did when we were younger. So this is part of why you start to have some balance issues if you're not having the medical side of it. We just don't do the things and movements we did when we were kids. We don't spin, we don't twirl, we don't turn upside down. And all those things keeps your body educated to the environment and how to move in the environment. Even walking backwards, like when do you ever walk backwards? So it's not practice, and then when we have to get in that situation, we lose our balance. So exercise and balance exercises make us practiced again. I mean, I'm not going to spin you around in a chair when you're here, but we walk in figure eights, we walk and turn our heads, we walk backwards, we walk sideways. We really cover a lot, and people are always surprised how quickly they feel improved. It is a practiced exercise, pretty much. So it becomes familiar again, and then your reaction to an outside obstacle improves. Okay. Strengthened exercises will also help you perform stairs normally and stand up from a chair without assistance. Next. I can't talk about balance without talking about posture. Do you know that your posture can affect your balance? Although many of us have bony changes that we can't reverse as we get older, because once the bony change is made, you can't really change that. But you can always work on your posture, and you can always try to slow down bony changes. How you stand on the ground changes your center of gravity. For example, if you tend to stand in forward bending and then you go to step backward, that might make you uneasy because your center of gravity is now forward and in front of your feet. And in addition, you might, because you're bent over forward, you maybe not be able to look ahead as you should for obstacles. Do you know that shuffling or short step length can make your balance worse, even though you may feel safer? Like, how many people shuffle because they're like uneasy about where they are? You start to decrease your arm swing. And the studies show that that's also a balance indicator. You know, a lot of people keep their arms tight to their sides. Are your calves tight? Can you believe this is a balance thing? Well, it is. If you can't lift your toes up from the floor and they're that tight, think about it. As you're walking, you're not clearing an obstacle because you can't lift your toes up. So this is a tripping issue. So when you go to do a curb or stair or step over an obstacle and your toe drags, you know, that's an issue. So even stretching is very important to balance. So let me show you Mr. Spine. I don't know if you can see this. Okay, so your spine should be a very small S. So you have a curve up in the neck and a curve coming down your back, and then another curve towards your hips. Why were we made like that? Because think about it, and our men that like to work on cars and our women that like to work on cars, think about how a shock absorber works. So those curves and those discs and segments is your shock absorber. So if you flatten out those curves, guess what? Your shock absorber isn't working as well. And your center of gravity, which used to be down the center of the S, is no longer there. So if you're bent over or you have a sway back, your center of gravity changed and your body has to adapt to that. So when you have to step a certain way, now your body is not centered like it used to be, so it has to try to adjust another way, and it might fail you in that reason. Next. Does diet matter? Of course diet matters. A healthy diet gives your body the right vitamins and minerals to keep your body at its peak. So this is another balance thing. Vitamin D deficiency. It's a big topic. I'm sure you probably have all heard that, and maybe some of you are on vitamin D supplements. It's greatly associated with decreased muscle function and performance. So in English, it affects your walking. Hydration, you got to drink water. So how about this? As we, another great thing about aging, you lose your sense of thirst. So by the time you're thirsty, you know, it's too late. But think about how your body is made. Every cell is made of water. If you're not drinking water, you know, you can become confused, dehydrated, and very weak. I'm divorced, but my father-in-law at the time was starting to get very confused, and we all were very surprised that his diagnosis was dehydration. And once he started getting the fluids he needed, you know, it really resolved those issues. So it's very, very important, not only for that, but for kidney problems and urinary problems. I just want to mention, because I have patients that say, well, I had 3 cups of coffee this morning. I'm like, oh, okay. So caffeinated drinks, although they contribute to your overall amount of fluids for the day, I don't know about you, but after I have 2 cups of coffee, I'm in the bathroom. So you're losing fluids. It makes you pee, pretty much. So that and fruit juices also make you urinate. So you want to make sure it's water. You can put flavoring in the water. I know a lot of people don't like water, but it is very, very, very vital and very important. Next. So let's get back to the postural exercises. So now we're going to start showing you some exercises. So for those of you that think they can handle these exercises, I want to precurse doing these exercises because I was a little leery about giving out exercises. I don't know each of you. I don't know what your issue is. So I don't know how safe you are at home. So as you look at these exercises, I want you to be very critical about the ones you're going to try and whether you can do them. I tried to pick some general things and some things that were safe. So please just keep that in mind. If you are unsure, just, waive the one you're very unsure about. I think Linda is going to give out my email at the end. So if you have some specific questions on the exercises, once you try them at home, I'll be very happy to email you back. Okay. So I had done a posture and how it affects balance seminar probably about 3 years ago. So this slide mentions how to assess which posture exercises you should do. They're all pretty good for you, so I wouldn't be afraid to do any of them. But if you want to address something specific, what you can do is stand against the wall. So when you stand against the wall, it tells you a lot, believe it or not, because you should be able to touch certain points to the wall. And if you're not, then you have an issue. So if you can't, for example, a good example and an easy example is if you stand against the wall and your back's, your butt's up to the wall, your shoulders are to the wall, but you can't get your head to the wall, you have a forward head. And a lot of us have a forward head. It is our society. We are a forward bending society, and it gets worse all the time with the phones and the computers. And our kids are just going to be a C, in my opinion. But, a forward head, I hope you can see me, is when you're this way. Like, how many of us are this way all the time? So that's very important. Remember I said if we're bent forward, well, now my center of gravity is now forward. So how do we fix that? We're going to do a retraction. We're going to talk about the exercises, but that's a good example. If you can't get your shoulders back, you have tight pectorals. Why is this important? It's your overall posture. You can get a lot of shoulder issues just from rounding your shoulders. So that's an issue. If your curve is off the wall too much and you can't push your back up onto the wall, you might have a posterior tilted pelvis. A lot of us that have big bellies or sway back. That's a lay term for it. Again, now you've changed the curve in your spine and your center of gravity is off that. So rounded shoulders, we're going to you're going to tighten your lats and your rhomboids and your posterior muscles by your shoulder blades. You want to work on those like rows. You want to stretch your pectoral muscles. Posterior tilt, you're going to work on hamstrings and abdominals, and the weak muscles are your glutes and your multifundus. We're going to talk about more of this. If you're anterior tilted, now posterior tilted, you're flat back, anterior tilted, you're sway back. Do your knees go in? Do your knees go out? That's valgus and varus. Okay. And they list the muscles that you need to work on for that. Know your limitations, okay? All right, next. Okay, so here are some really great exercises. I think they have a pretty good description. So here's the forward head exercise where you're going to do a chin tuck. Remember I said if you're like this, this is a very easy exercise. If you are very forward headed, you're going to feel a little bit of tightness behind your skull. That's normal. Um, a lot of these exercises you might feel, some discomfort. You might get some muscle soreness if they're muscles you haven't been working on. So these are expectations to have, but once you get in the habit of doing them, it'll start to feel better. So that forward head one, I can't tell you how important that is. You can do that laying down. You can do it sitting, standing. You can do it in any position that you want. I like to do it in the car. I tend to sit forward in the car, and then the headrest is like perfect to work on that. Increased spinal curvature, you're bent over forward. These are TheraBands. You can get them very easily in any store. Our bands that we use are called TheraBands, but there's other bands out there. They're just resisted bands, and they come in different colors and different resistance. And the company will tell you how the series goes. Like ours is yellow is very easy, red is medium, green is getting a little heavier, and blue is hard, and black is impossible. So this is TheraBand exercises that you're seeing here. It's a very reasonable thing to do. You can do so much with them. So if they're not a bad thing to invest in. The first one is an increased curvature. So all we're doing is you're looping that band around, if you have a heavy kitchen table or whatever, the leg, and you're extending your arms and you're pulling back straight. The next one is, again, for rounded shoulders and curvature. This is external rotation with the band. Again, if you have a history of shoulder issues, again, you might want to watch it. It can actually help you. Like I said, I don't know you. I don't know your medical histories. So try it. All you're doing is you're rotating the arm away from your body. And anterior pelvic tilt, posterior pelvic tilt, and knee valgus, you can all work on in a bridge position. If you can't get on the floor, you can do these on your bed. Your bed is a little soft, so it's a little bit harder to get some footing, but you can do it. Or you can get like a stiffer mat, exercise mat, and put it on your bed to make your bed a little more hard, so you can do the exercises easier. Bridging is super important. It's great for your glutes. It's great for helping you be able to do the sit to stand from a chair and to do your stair climbing. They also show a side plank. So planking sounds like an advanced exercise, but you can bend your knees and make it a little less aggressive. If you ever get to the point where you can straighten your knees, then kudos to you, because that's really hard. But you're putting a pressure on your elbow, and you're just trying to make your body straight there. I don't know if you can see that. And then the last one, I teach this a lot in our department. This is for knee valgus. Your knees go inward toward each other. So this is called a clamshell. It's great for your hip, and it's great for your knees, and it works that smaller muscle in your bottom called glute medius. And all you're doing is opening up like a clam, as you see him. You can do this without the band. I would do it without the band first, because you're going to feel that, and then you can start adding resistance. On the bottom of each of these exercises, you'll see target sets. It'll tell you if you need to hold the exercise, and it'll tell you some repetitions. And I like it because it gives you a wide berth. So you don't want to ever start with 3 sets of 15, the highest. You want to start with maybe 1 or 2 sets of 10. If you can't do 10, you start with 5. Just break it down and be reasonable. If you're not an exerciser and you're just starting these, start very low. 2 sets of 5. Try to then get to 1 set of 10. Then try to get to 2 sets of 10. Like that. Next. This is a doorway stretch. Again, I teach this quite a bit. You can do a doorway stretch with both arms up. Some people aren't able to do that, it's too uncomfortable. So they're showing a single doorway stretch. So you're going to put the arm up like that, and you're just going to rotate till you feel your pectoral muscles stretch. Okay, it's really great. And you always hold a stretch. As you see at the top, it says hold the stretch for 20 to 60 seconds. And you do like 3 of them. The bottom portion of that one is a lateral stretch. A lot of us can't get our arms up over our heads. You can start with just bending to the side. Please feel free to modify these exercises to your ability. Okay, these are not strict rules when you exercise. I like this other exercise down here, the forward head, increased spinal curve, posterior tilt. This is called a cat-cow, and for some of you that are familiar with yoga, they use that term cat-cow. It's usually done on hands and knees, and you can certainly try that if you are more advanced. But this is a nice way to get your lower spine mobilized by just over curving. So over correction, that's the top picture, and then flexing out of it like bad posture and just rocking back and forth and just trying to get that pelvis to move a little bit. On the bottom is a hamstring stretch, super, super important. When our hamstrings are tight, it pulls the bottom of our pelvis and it'll flatten your back. And you know, your mobility is impaired if you're really super tight. So this is a nice, gentle way to stretch your hamstring in a seated position. But I want to point out you're not rounding your back, because then you're going to misinterpret that maybe your hamstrings aren't that tight. But when you round your back, you're not holding your pelvis in the right direction. So you're getting a stretch. You're easing up this stretch by bending your trunk. So if you sit up straight, you're holding your pelvis in alignment, and that's when you're going to feel that hamstring stretch. So his foot is pointed up. You want it nice and straight as you possibly can tolerate. And you just lean forward, and boy, you will feel that. Next. Okay, so now let's talk about some balance exercises. I hope everybody's doing okay. I pulled these off the internet because I liked the way they were set up, the postural ones and these. It does say for seniors. That does not mean it's only for seniors. Next. Okay, so these are the exercises, but we're going to go through each one. Next. Okay, so this is just an intro on these people's way of looking at things. So, but they're good to look over. So it says everything we were just kind of talking about, the stretching, the mobility training. Let's go next. All right, so let's address this. So balance exercises. This is where, remember I said I was a little nervous about giving balance exercises because, you know, I don't want you to fall at home trying a balance exercise. So they show these exercises with a chair. That's okay. But if you really think you may fall, I prefer a doorway. So when you stand in the doorway, you have something to grab on, you know, to stop yourself on either side. That might be a little safer. But if you need something to hold on to, maybe like stand by your kitchen cabinet or your kitchen table, you know, something level that you can put your hand on if you need to stop yourself. The chair, I'm afraid if you grab the back of the chair, it's just going to go over. But if you have a very heavy chair and you're a little more advanced, you know, you can do them next to the chair. So this is a single leg stance. Sounds so simple, right? How long has it been since you just stand on one leg? So always start on a flat surface. And you're just going to pick your opposite leg up a little bit and maybe hold it for 5 counts. So the goal here he has is 10 counts. You might have to work up to that. So you're totally not holding on, kind of thing, for 5 to 15 seconds. If you can't do that and you're not even comfortable with it, you're going to hold on first and lift the other leg and just get used to putting all your weight on one leg. And that's an exercise in itself, because standing on one leg, you're cueing your hip joint, your knee joint, your ankle joint, and you'll see yourself, we call them strategies. Maybe your ankle's weak. So you're going to see a lot of ankle wobbling, or your knee or your hip. So it's interesting to look at people when they're standing on one leg. It's a really great and easy exercise. And the other reason it's important is because when you walk, you spend time on one leg. So we do this with all our patients pretty much. Try to get them to stand on one leg. The more comfortable you are on one leg, the more even your stride when you walk, because you're comfortable having all the weight on that one leg and start not shuffling as much. So the goal would be that you can increase your time on one leg without hands. That's the ultimate. But you can start by holding on and just lifting one leg. Next. Foot taps. This will also help you get to that single leg stance. We use cones. You can use, I like what this gentleman's using, just a step stool. Hopefully you guys all have step stools to get to things. So all he's trying to do is tap his foot on the first stair of the step stool. And again, this is keeping time on one leg. So you're not putting your weight on that first step, because then you're just standing. So you want to just tap it and then put it back. So you're tapping the first rung or a cone or whatever you have, a water, you can even use like a water bottle. You know, the higher the item to tap, the harder it is. You might want to start with something low, like a book. So you tap the book and down, tap the book and down. The slower you do it, the more challenging it is. If you tap fast, then you're really not getting the benefit out of it. So now he's holding the chair to start. So if you are very uncomfortable with the motion, hold on to start. A lot of patients I work with, I let them hold on for the first few just to get their body used to doing the pattern, and then I have them try to let go. And when you let go, it's a whole new ball game. It's always easier when you're holding on, even if you're just using like a finger. Next. Narrow stance reaches. This one's a little bit harder to do, but in a functional world, it is a very functional exercise, because how often do we stand in the kitchen and reach for a dish? So you're moving your body over your feet and you have to recover. So it's when you, again, we talked about center of gravity and moving forward. The more comfortable you are moving away from your center of gravity and coming back and maintaining it, the better you're going to be functionally. Think about how many times you do this in the kitchen, the bathroom. Those are the two biggies. But it is a hard exercise to do, and it makes me a little nervous. So maybe you're going to put yourself against the wall, so you're leaning, and you're going to just lean forward over the chair. You can always grab the chair. You can also start with just reaching forward with one hand and coming back, maybe holding onto the chair, have the one arm straight, reaching forward and back. You're not bending, you're leaning forward. We actually use this motion as a fall assessment test. We actually measure how far. We put a ruler up on the wall and see how many inches you can go forward without losing your balance. And we look at that again, after we've worked with you for a few sessions. Next. Okay, this one you're standing shoulder width apart. and you're extending your leg backward. This is a hip and buttock exercise. Um, your hip strength is super important with walking. A lot of people don't go in this direction to exercise or out to the side, and hip stability really assists in good walking structure. So this is a good exercise. You're trying to control it though. You're not just swinging your leg backward. You have to make it nice and tight and feel that muscle contract in your bottom. Next. Standing marching, we do a lot of this also. Start on, again, all these exercises start on a flat surface, and I'll tell you why I'm saying that. So again, he's spending time on one leg. So you want to do them slow. So you're doing a nice slow march, maybe start with holding on, and then maybe move to a doorway where you have something to grab if you need. And then, you're trying to do them without holding on to anything. Slower, the more challenging. Next. Mini lunge. After I did my certification, I've added mini lunges to my program a lot. Remember I said bending forward is a functional thing? Well, mini lunges is a functional thing. You might not be in exactly this posture, but you're stepping forward to grab something and then trying to step back with it. So I do a lot of this with target touching. So this gentleman is doing it holding on to start with, okay? And you're taking a longer stride than probably what you're comfortable with. You're leaning forward on the front leg, and then the hardest part is pushing off that front leg and coming back to having your feet even again. Okay. I'm sorry, next. I didn't say next. Lateral stepping. Okay, now you're stepping out to the side. Remember I said moving your hip out to the side is important. I have a lot of my patients just doing side steps along the railing, and even to this day, I feel it when I do them, and that's not even with any weight or any resistance. So this is just a lateral step to the side, just getting used to, remember we talked about changing directions and getting used to moving in different directions. Well, lateral is a direction. So if you're at your kitchen and you're moving down your countertop to get something, guess what? You're sidestepping. And that's a good point. You can use your kitchen counter, really works great if you want to not just step and come together. You can just sidestep all the way down your kitchen counter and then sidestep all the way back. Great exercise. Next. Mini squats. So mini squats will help you with your sit to stand. Sit to stand is a big fall indicator. If you can't stand up from a chair without pushing with your arms, we use that as a fall indicator. When I say fall indicator, we don't use just one thing, but it is one exercise we use in our assessment as a fall indicator. So I work on this all the time with pretty much everybody. If you're not comfortable with this, like holding onto your kitchen table or counter or the back of the chair, you can actually practice from the chair and maybe put a pillow to make you higher in the chair and try to get up from the chair. And then you can just sit down and stand up. That is actually an exercise. So the goal would be no hands. So the higher you are, the easier it is to stand up. So we have tables that we raise up and down. So I'll start with the table raised until my patient can stand up with no hands. And then, as we practice it, I start to lower the table until it's almost chair height. And almost everybody leaves therapy being able to stand up at least once without using hands. Now I'm saying that as an exercise, but as a safety thing, it's always good to have your hands on the arms of the chair. Next. Okay, so this This is a little more risky, but an excellent balance exercise. So tandem means one foot in front of the other. The closer your feet are to each other, the heel to toe, the harder it is. The wider you keep your feet apart, the easier it is. You might have one leg that's weaker than the other. So I always have you do them with the right foot in front and then with the left foot in front. So you want to vary which foot is in front when you're holding this position, because if one leg is weaker than the other, you're going to see a difference. This might be one that's better done in the doorway, because you can hold on to the doorway, put your feet in the tandem position, like on a tightrope. That's what tandem means. And then try to hold that position. Very, very hard. So if you can't put them exactly in line, you can start with them a little bit apart, striated but apart. That makes it a little bit easier. So again, when you're looking for, just like with the single leg stance, you're going to hold for a certain period of time. Again, if that's 3 seconds, 5 seconds to start, that's fine. You just start increasing your time. Next. Heel raises. Remember we were talking about the toes? Well, strong calves are important too. So heel raises, we always teach heel raises. I always teach toe taps in addition to this. I'm not sure if this covers this or not, but you could do toe taps standing, pulling your toes up, or I like to do them sitting, and pulling your toes as high as you can. You're going to feel that in the front of your shins. The heel raises, you're going to feel in the back of your calves. Next. Okay, and I had said that hamstring stretch, that one sitting, was really great, and I pretty much described it. Remember, I said you have to have your back really straight. If you bend over, it's not going to work as well. You can also do it standing. If you're super tight, you're going to feel that right away. And if you want to advance, I'll just mention it, you can lay on your back and hold the back of your knee and bring your leg up that way. The seated one is just the easiest one to show you to start with. Next. Calf stretch. Okay, so you can't lift your toes up. What are you going to do about that? You're going to do some calf stretching. It makes a big difference. Stretching, though, really takes practice, a lot of practice. So you have to be consistent if you want to see a change in your flexibility, especially as we get older, because, you know, things are more solidified. So you want to really try a couple things daily. It doesn't take that long, especially for maybe a hamstring stretch and a calf stretch. He's showing it with the toes against the chair. Or what you can do is, if you have a stair at home, you can hold on to the railing and let your heels drop off of the stair a little bit, just to tolerance. Or I wish I had a picture of the runner stretch. Instead of just holding the edge of the chair here, you're going to put your hands on the wall and put your foot behind you and lean forward. Have you ever seen the runners do that? That's a nice way to stretch your calf. But this is good. And this will help you with the toe lifting. You need the strength to do that, but you need the flexibility to do that. I can't tell you how many people, I can't even move their feet. Okay, next. Okay, these are my references. Next. Okay. All right. I just want to go back to the exercises just for a second. So remember I said a level surface. So now you're doing really well with them and you want to challenge yourself a little bit. So you can make it an uneven surface. So you can take a cushion from a chair, a very small cushion, you know, and start standing on that. We use it's kind of like a foamy mat to practice. Again, I want you to do it in a safe environment, whether it's in the doorway or make sure somebody's home when you try that. But that's a way to make it harder. We talked about holding the position maybe a little longer, doing more reps, and that makes it harder, you know. So those are things you can do to make those balance exercises harder. So I said I would include some resources. Um, Remember we discussed if you feel that your symptoms related to those diagnoses is in the first part of the lecture, you really need to go to the doctor for that. And you all have your own doctor, so I didn't mention anything. Um, for physical therapy, of course, I listed our facility. So that's the phone number for our facility. I list it because A, I work for them, and B, we have vestibular rehab. We actually have two therapists that do it. Um, we have two therapists that do concussion, and I'm certified in balance, but we all do balance. So I can certainly advocate for what we have here. Hackettstown area, I know you guys are virtual, so I don't know how far out I'm reaching, but I'm kind of talking about this area because this is where this is coming from. So I did list local. We have a ton of physical therapy places in this region, and they all do a great job. I can't verify what they have at that particular facility. But what you're going to do is, if you don't want to come here and someone said, oh, here is great, you want to make sure if you want to go for vestibular rehab that you call and make sure they have a certified therapist in vestibular rehab. So that's how you're going to investigate where you can go. Okay, and where your insurance covers, because a lot of facilities are different as far as insurance coverage. So even though I would love you to come here, if your insurance isn't optimum for our facility, call another facility. Don't give up. Oh no, I didn't put their phone number. This company is called Back Home Safely. They are in the Hackettstown area. They're actually opening a second facility, I think, in Pennsylvania. They do home modifications. They are actually now partnered with Atlantic Health System. I've worked with them on our Well Balance clinic that we had here. I've done several seminars with them, and I am amazed at what they do. I just can't tell you enough about them. Anything you could think that you may need a change in your home, they will do, whether it's a railing or a ramp or lighting fixtures, changing the height of an outlet. There's so many things you can do to change your home even easily to help with your balance. Putting night lights on, when you on your route to the bathroom. Maybe they have a motion sensor if you don't like having a light on all the time. There's just so many little things you can do. If you have to reach for your lamp to get up at night and it's, not in a good place, maybe you can get a voice activated lamp or a touch lamp. There's those little things you can do, and they do it all. So I'm sorry, I must have thought I was going to look up their number, but they're called Back Home Safely, and they're very easy to look up. They are in the Hackettstown area. As far as fitness, again, Hackettstown is loaded. All I did was go online. I have no partnership with Planet Fitness or Retro Fitness. I just listed them because they were local. Of course, our fitness facility here is a medically supervised fitness program. It's called the Live Right Plan. When we discharge patients, we give you a free month in our clinic because you're used to the machines, and some of you need a little bit more supervision. And our exercise physiologists are trained for clients with medical issues. We have machines that are modified if you have, say you have a stroke, but you want to still exercise. We have mitts to hold on to the machines, and modifications that you can still exercise. So it's a great program. You can pay by the month or quarterly or whatever. So we are here, like I said, Planet Fitness opened up downtown, very reasonable. Retro Fitness, I think Riverside's been around forever. There's just a ton of facilities. So again, if you are at that level and you think you want to start exercising, but you need a little guidance, all these places have trainers. If you're interested in yoga and Tai Chi, um, again, all I did was go on the web. I'm not associated with these facilities. I don't know much about them, but they did list many levels of classes. That's why I put it. So there's Serenity Yoga and Wellness Studio, and I think Center Point Wellness is right on Willow Grove here, and Gallery Bar. So I had a little trouble finding Tai Chi, but those facilities actually, the 12 Rivers Acupuncture has Tai Chi, but it's listed as, and I'm sorry, I'm not, like I said, I've only even tried Tai Chi once. It listed it as something different than Tai Chi, but it is a Tai Chi exercise. So if you call those facilities, Centerpoint Wellness had it, and 12 Rivers Acupuncture had it. And a lot of the retirement villages around here, if you are watching me from one of them, I know they run a lot of exercise programs for you guys. So if you see that listed, chair yoga or Tai Chi, give it a try. Give it a try. You really will like it. And it really, really helps you quite a bit. All right, I can answer some questions. Can I, Linda?
Yes, you can. Thank you so much. At this time, we are going to go ahead and open up the Q&A. I know I've seen a few things come through, so let's go ahead and get started. All right, the first person is looking for a recommendation on what type of doctor you would recommend they see for treatment or therapy. They stated that they have BPPV, neuropathy, bad knees, and they are on medication.
I would just go to the regular physician, can write a script for vestibular rehab if that was the question. Yeah, their general physician. That's fine. Yeah.
Mm-hmm.
But you need a prescription that says vestibular rehab on it.
Good to know. Okay, I'm seeing a few asks about the exercises she shared and the PowerPoint. I will be sharing all of that with you after today's presentation. You'll get that in an email. Seeing some agreement with your suggestions of places. I'll give it another minute or so to see if we have any other questions.
While we're waiting, there was something I omitted that I probably should have spoke about. So something embarrassing for a lot of us is issues with the bathroom and incontinence, and that's a biggie in the fall world because and I have people say that all the time, like how does that relative to falling? Well, you're having an urgency and you're trying to get there pretty fast, and when you have that urgency, you're not being very careful. So it's a thing that can be treated conservatively, not always with medication. Things have come fully around, and there's a therapy called pelvic floor. And again, we have two therapists that do the pelvic floor here. It's again, can be a series of exercises that they teach. It's in a private area, and it's a one-on-one session, and it's something that can be addressed for a lot of people easily. So it's something to also consider. So that's called pelvic floor therapy.
Thank you. We do have a question about what your thoughts are about swimming.
Oh, well. Oh, no, I lost you.
Well, we can still hear and see
There you
you.
are. Okay. Swimming, absolutely. If you are a swimmer, I am not a swimmer. I wish I was a swimmer. You have to, again, I don't know your medical background. If you have a lot of shoulder issues, sometimes you just have to watch what kind of stroke you're doing. But yes, of course, it's buoyant. It's great for your joints. You're not jamming anything. So absolutely helps with your endurance, your strength, your flexibility. It's a great exercise.
Okay, next question. Is there any exercise to help with, I might say this wrong, so please correct me if you know what I'm saying, uh, tinnitus?
Yeah, tinnitus is,
Thank you.
again, you need a medical diagnosis because tinnitus can happen for many reasons. So that I would see an ENT for, and find out why you're having it. I know um, some of the patients we see for vestibular have it. Now, whether it's reversible once you work on the vestibular, I think some people do and some people don't. So I think it's a kind of a hit or miss kind of thing, but it's certainly worth a conservative shot at trying to treat it. Yeah.
Thank you. We also have lots of thank yous for everything you have shared today. That your instructions were very clear and informative, and they've enjoyed it. Just a reminder, I see a few more asks about the presentation today. I will send over a copy of this PowerPoint and some handouts that she has given me on exercise, so you'll receive them via email shortly after today's program.
Are you able to include my email for them?
Yes, I
Yeah.
can.
Okay, like I said, if you have questions specifically, you can email me and Linda's gonna give you that email address, okay?
Yes, I will. Give it one more second. The last minute question. Okay, then I think we have answered all of them. So I want to thank you for joining today. We kindly ask that you take a few minutes after today's webinar to complete the program survey. The link to the survey has been added to the chat for your convenience. And a special thank you to you, Marguerite, for lending your time and your expertise today. If you have any additional questions or comments, you can send an email to communityhelp@atlantichealth.org, or you can call 1-844-472-8499. That concludes our webinar. Have a good day, everyone.
Thank you, everybody. I appreciate your time.
Thank you. Bye, everyone.
Thank you, Linda.